Reverend Katie Zay, thank you so much for being in this weekly conversation with me. Today, our topic is beyond single issue justice. Audre Lorde said, there is no thing as single issue struggle because we do not live single issue lives. But so often, that's not how we engage in our understandings of justice nor our advocacy for it. Typically, we focus on justice that in ways that overlook the intersections that are there. What do you feel this election season has been revealing to us about the intersections of various aspects of justice?
Mm-hmm. Oh, I love that quote. That's one that I've heard you share before. And I really empathize with that, wanting to focus in on a particular thing, because when we start unraveling, it can feel very overwhelming. But that's precisely what this year has done, has been a collective unraveling. And I know for some folks that was already their existence, but many of us, me included, are seeing in a very different kind of way just how everything is interconnected, because the systems in place were so fragile. All it took was just one disruption for it all to crumble down. And now there's a lot of disruption with that, but there's also the clarity and the seeing of how interconnected all of these different pieces are, and how overall the system wasn't working well. You know, if all it took was just one thing to shut it all down, and to see it all crumble down, then it gives us space to reimagine a different way of being. And we can't tackle a single piece, because if we're neglecting all of the others, then we're really not moving forward in terms of creating the kind of society we want to see, as you always say. So I think it's been a revelatory time, and how wrong we were in thinking that we were living these individual lives. I was thinking back to the early days of the pandemic, when everything was really shut down globally, and we started to see this regeneration in the world around us in terms of nature and kind of coming back to life. And for me, that was a really disheartening and inspiring thing, because to think about the impact that we were making collectively on the world around us, but also to see regeneration as something possible, really gave me some hope, and maybe all of us some collective hope about something that we haven't imagined before or didn't think was possible. And, you know, I was just thinking too, and I might be misremembering, but I can't remember an election before this one where there was conversation about the soul of the country. Is that something that you can remember from other
I do not remember ever hearing that before.
Yeah, so really thinking about how profound that is. And when we talk about the soul, our collective soul, we're reckoning with our words and our actions and our values, and how those things are or are not in alignment. So yeah, I think it's the crumbling down of things has been a time of reimagination. And that includes looking at things in a different kind of way than we had before, in particular. I mean, and not everybody, but I think for white folks especially, like seeing how interconnected everything was in a way that maybe we didn't see before.
That is so exciting to me as you talk about the soul of the nation and values. We have a segment of the Compassionate Care workshop that talks about values clarification and negotiation. And so part of what we're wrestling with as a nation now, in ways that more of us are acknowledging and participating in that wrestling, is what is it that people value? And sometimes we have competing interests and competing values, and how do you negotiate those as a society? And so much of that is happening now. And when there is that single issue approach, it often comes to, no, we've got to focus on the environment, or no, we've got to focus on prison reform, or no, we've got to, focus on racism, and no, we've got to focus on healthcare, when they're really this amazing intersectional fabric, and how do we approach that in some powerful ways. So I want to come back to that in a question, because in a minute, because I think compassion has something important for us to understand with this. So during COVID-19, which is the primary thing that has pushed so many of us to recognize the intersectionality of justice, many of the people who have been regarded as essential workers have been people of color, have been women, have been individuals already not making enough money. They're being paid minimum wage, which is not a livable wage. We've seen housing, the fragility. You talked earlier about how fragile so the fragility of housing, the fragility of public health and income equity and childcare, which I remember when I was in my 20s, which wasn't last year, we were talking about childcare then, and it still is a lingering issue to be dealt with and addressed in this country. And public education and reproductive freedom, we're seeing all of those things being revealed in some powerful ways. But of course, so much of it comes in the bodies of and in the lives of women and people of color, and those who are not earning a living wage. Mm-hmm. What do you hope this pandemic, in all that it has revealed to us, what do you hope it will help more people understand approaches, intersectional approaches to these issues? And what does compassion, if anything, have to do with it?
Mm-hmm. Yeah, I think this is a moment to get really honest about what has always been true and what is true now. And as you were talking, I thought of this tweet I saw, and I'm not going to quote it exactly right, but it was something like, there's never been a complete shutdown. It's been wealthy people and middle-class people staying home while poor people have delivered things to them during the pandemic. And that really struck me as true. We're a country that talks about or has talked about family values, and yet if you look at our spending collectively in our programs, we're at the very bottom of countries in terms of investing in programs that support families. And I was just writing about this morning, that in thinking about how our values are not in what we say, they're in how we invest our resources. We talked about
Amen.
The budget as a moral document. Where are we investing? It's not in families. And this society is structured in a way that, and has always been true, it's dependent on underpaid, unpaid, and invisible labor of marginalized people. And that has not stopped in the pandemic. So we don't have these structures in place to get critical services that we all need. I mean, we all need access to food. We need to be able to go get healthcare, no matter what's going on. But folks have to do that while being underpaid and putting their lives and health at risk and their families at risk. Like thinking about if there's no childcare options for folks who are in these essential care jobs, where, kids are being left behind, uncared for, or it's just all very precarious. So these essential workers, and they really are, what does that mean, right? Essential means we cannot live without them. Don't have a way to live without showing up to these underpaid and undervalued and really risky jobs. And I mean, we could talk about all of the ripple effects of that all day long, because it just keeps spiraling if you think about it. But I think, again, just related to the question we were talking about before, how can we reimagine ourselves in this moment? What is it that we can dramatically shift to create a different kind of society in which essential workers are paid well and their lives and health are protected? What are other ways we could get some of these services delivered to people without putting people's lives at risk? I mean, I just feel like there's so many opportunities right now to really recreate what it is we want to see. But it can be a bit overwhelming because of how we're all living in kind of a collective fear and anxiety about what's going to happen.
You know, as you talked about the budget as a moral document, I often think about who gets paid what in this society. And how is it that Arizona, where I live, is one of the states, I think it's either ranks 48th, 49th, or 50th in terms of what teachers are being paid.
Mm.
And so it speaks a lot about the value here in this state, and there's so many other states. And it's not that there's not enough money here, but there's also the taking away from the budget tax revenue that could be available so that there's more funds for affordable housing and public education and childcare, et cetera, but no value for those kinds of things. I heard a woman on Fox News several months ago as she was complaining about the possible revocation of visas for people from other countries, including nannies. And so it wasn't a concern about the impact of that policy on those people. It was, of course, the impact on her life, because
Right.
then she wouldn't have her nanny. And you're talking about how we can imagine in some new ways. How might compassion help guide us in reimagining? Because all we know is this system that most of us have inherited, or I'll say all of us have inherited a particular system where entertainers and athletes, and I am giving great thanks to them, but the millions and millions of dollars that they are paid relative to childcare workers, relative to people, to teachers, as I was just talking about them. You know, the income inequity is not only based on gender, but based on profession. And as someone who has worked hard and acquired a lot of education myself, I'm grateful for the income or the salary that I make. I'm grateful for that. Yet for the expenses I've undertaken, my salary is low relative to the expense.
Yeah, that's a good point.
And however, my salary is high relative to the personal risk that I take every day in doing my work. So, I mean, you know, there's a lot of things. And so there's so many complexities and nuances when we think about living wages, when we think about public health, affordable housing, et cetera. And we know that, as you said, quarantine or stay at home has looked very different depending upon people's income. Some people have not had the luxury of staying at home. They've had to go out and not having childcare all at the same time. Many other people, such as yourself, have stayed at home, but you've also had to provide your own childcare and education while doing so.
Right.
What might compassion offer us as we reimagine the society that we want to be, where there is more income equity, where there's more value for the work of all people. Does compassion have anything to offer us?
Yeah, I mean, I don't even know if it requires a whole lot of imagination, in the sense that there are places and there have been policies proposed even in the United States that would have offered some of the things that we wish we had in place now. I think about some of the proposals in the late 70s and 80s around providing universal childcare, for example, right? That was a real idea that was being moved forward, and it was squashed by the religious right, saying all of our children would be raised by the government. But now just looking at how essential it is for, if we want to have a healthy workforce, like if we look at how many women have dropped out of the workforce. I don't know if you've seen those reports, but since COVID, it's disproportionately impacted women in terms of like unemployment. I think in large part because of this childcare issue. So we have models of places that are doing better with all of this that we could learn from if we would humble ourselves and think that maybe we don't have the best system in place. So in that way, I just feel like we have to kind of confront the American exceptionalism myth and really say that's absolutely not true. Look at how all of it's crumbling around us, and take some lessons from places where they really have invested in programs that have supported families. There's plenty of models that we could learn from. So I don't even feel like we have to reinvent the wheel. I think it's just a matter of taking lessons from folks who've done it better than we have. And really, the other thing I was thinking of when you're talking about income inequity is just thinking about corporations versus small businesses right now. And I'm just seeing small business after small business just not be able to make it during this time, because they don't have access to resources that are going to allow them to stay open. So I even think about the impact of folks who've had like a family business. We talked about entrepreneurship as the American dream, and like those folks are failing too. It's like every single myth about who we are has been brought to the surface, and now's our opportunity to confront it and move forward in a different kind of way.
So I appreciate you mentioning how the religious right blocked universal child care. So, earlier I said, I remember all the efforts toward that when I was in my 20s. And so that was in the 70s that I was in my 20s. That's amazing. How can progressive Christians, Jews, atheists, whatever we might be, help inform the conversation about compassion in ways that break through and tear down some of the efforts that the religious right has had that has really been completely devoid of compassion? To the argument that don't want the government raising your children does not in any way comport with what compassion calls us. So how might those of us who are progressives of any religious or non-religious perspective help people get to truth about what some of those efforts, those compassionless efforts, have really been about?
The roots of that white Christian nationalism was about power over and not engaging folks impacted. Who's impacted by not having access to childcare was not the people speaking against it. So I think compassion, where whoever is bringing that forward as a value, it ensures that the people who are most impacted are at the center of the conversation, and not just sharing their stories of impact, but coming up with the solutions about how to transform our society. That's where we should be reimagining. That's where we should be listening. And I think that in compassion, there's no room for judgment. So when ideas come up that are maybe radical or different or haven't been tried before, the call to compassion is the call to pause and to listen and to take in and to imagine with people, rather than to speak for them. So that's how I think compassion transforms us individually and collectively. It's really in creating that space for a new narrative to come to the center that we hadn't considered before.
What you are raising, developing policies, developing programs, services, systems, structures, with the central question of who is impacted by this.
Mm-hmm.
That's not been a guiding question for most of the policy development and development of systems and structures, et cetera. Who is most impacted by this is such a critical question. And something you said earlier about how it is the reality that many people in their own bodies bear the intersectionality of justice or intersectionality of injustice. Mm-hmm. And so really having at the center people of color or women of color who are often underpaid workers, having as central to the conversation individuals who are disabled. They can speak to us about public health in some ways that are often not part of the conversation. Mm-hmm. And so really inviting folks to be center in the conversation who are often not even included at the table.
Right. And for them to be compensated well for their labor.
Indeed. So thank you. That's what I want to leave folks with today, is for each of us, compassion demands of us to ask, who is impacted by these policies, by these systems, these structures that we have in place? And if we allow that to be a guiding question, it greatly helps us reimagine how we move forward in this moment.
Mm-hmm.
Thank you. Bless you.
Thank
Amen.
you.
Amen.